Thank you, Mr. President. Let me associate myself with the remarks of the senator from Massachusetts. There's a lot of work that we need to do this week. She's right. There are healthcare crises right around the corner for millions of kids and families that we could be working on solving right now. As the senator knows, both Connecticut and Massachusetts are still being wrecked by an opioid crisis, one that is getting worse in my state by the year, not better. We could be working together on that. We've got brothers and sisters all throughout the United States that are right now in crisis because of devastating storms that have hit. We could be working together on trying to provide a meaningful response, and we aren't yet. Again, we are back now talking about Trump Care Redux. This is version 10, version 11. I think there's been 3 versions already this week. And this one is really the most dangerous version yet. CBO just released a scaled-down analysis noting that there was no way that they would be able to provide a full analysis given the compressed schedule, given the need to pass this by the end of this week because of Republicans' desire to make sure that not a single Democrat is included in the negotiation. But they gave us some hints as to what their score would say once it was fully completed. Federal spending on Medicaid would be reduced by $1 trillion over the course of this decade, and there is simply no way to rip $1 trillion out of the Medicaid system. The Medicaid system, by the way, as all of my colleagues know, which provides insurance to the disabled, to children, and to the elderly, without millions and millions of people losing access to health care, people who have nowhere else to go. CBO, unsurprisingly, says that the number of people with comprehensive health insurance would be reduced by millions, and they predict that states would allow insurers to set premiums on the basis of an individual's health status. And none of that is news to people who have read this piece of legislation. But I want to just talk for a second about why CBO comes to those conclusions and why this is the most dangerous version of the bill yet. In this bill is a massive reordering of the American healthcare system. The healthcare exchanges, which right now insure millions of Americans across the country, are essentially eliminated under this bill because the whole reason they existed is to funnel tax credits that are attached to individuals based on their income to help them buy insurance. Those tax credits go away under this proposal, thus the exchanges go away. Medicare as an entitlement is ended by this bill. No longer will you as an individual have a payment from the federal government attached to you because of your income or your health status or your disability. States will now get a block sum of money to do with essentially what they wish, which may or may not cover the same amount of people today covered under Medicaid. And while proponents of this bill are trying to contend that it still protects people with pre-existing conditions, no one is buying it. No one is believing it. Because on the face of the text, it does not. And it's important to explain why that is. Well, technically, it is up to the states as to whether they protect people with pre-existing conditions. States, under this new version, can just sign a form that allows them to permit insurers to price based on medical acuity again, meaning charge sick people more. They will have to exercise that option under this version of Trump Care. They will be forced to exercise that option because what is also eliminated by this version of Trump Care is the requirement that healthy individuals buy insurance. You cannot require insurance companies to charge sick people the same as healthy people if you don't provide incentives for healthy people to sign up. And there is no incentive under at least the latest version of the bill that I read. Thus, anybody who has taken a semester-long worth of education on insurance practice will tell you that states will be forced with two choices. One, reimpose their own individual mandate, and I'm going to guarantee you that based on the vitriol that has been launched against the individual mandate from Republicans in this chamber and the House of Representatives over the past 6 years, most states will probably not take on their Republican senators and congressional delegation by passing their own individual mandate, or they will be forced to drop the protection for people with pre-existing conditions. CBO and JCT anticipate that many states, I would argue the majority of states, will have to drop that protection for people with pre-existing conditions because they won't pass an individual mandate. Thus, rates will skyrocket for sick people or anybody that has ever been sick, making insurance inaccessible for Americans that have had a cancer diagnosis or an addiction diagnosis or a mental illness diagnosis. This bill is a massive reorientation of the American healthcare system, the elimination of Medicaid as we know it, the end of the healthcare insurance exchanges, the end of the tax credits to help people buy healthcare insurance, the end of the mandatory national protections for people against abusive insurance practices. And we are potentially going to vote on this later this week without a CBO score, with one hearing, with no markups. I don't care how mad my Republican friends were about how the Affordable Care Act was passed. That was done in an open process with dozens of hearings, with markups in every committee, with 30 days of debate on the floor of the United States Senate, with hundreds of Republican amendments that were offered and adopted as part of the Affordable Health Care Act, with over a year of public input and debate about the pros and cons of the proposal. None of that is happening on Graham-Cassidy. This thing is being rushed through in the dead of night with no time for Americans to review it, no time for members of this body to look at it, and no ability for any senator in the Democratic Party to be able to have any input into the final product. This is nothing like what happened on the Affordable Care Act. And no matter how mad you are that in the end you couldn't vote for it, Republicans had plenty of opportunity to have a say. The American people had plenty of opportunity to take a look at it. It's not happening with Graham-Cassidy. Because there's no CBO score, we have to rely on outside independent groups to size up the potential disaster of this bill. The Center for American Progress, which admittedly is a left-leaning organization, but one of the few that's taken the time to take a look at the text and what it will mean, came to the conclusion that 32 million people would lose coverage. And the Commonwealth Fund, which is not a political organization, the Commonwealth Fund, which is an independent, nonpartisan healthcare think tank, essentially came to the same conclusion, saying that after 2026, 32 million people would lose coverage. The Commonwealth Fund says 15 to 18 million people could become insured by 2019. So I've had this chart up here for now 3 or 4 months, and I've had to just adjust it over and over again because it started out with 23 million people losing insurance as we analyzed the first Republican repeal bill. Then when the new version came in, you can see I had to write in 22 million people because the amended version that we were going to vote on right before the break was 1 million better. But now I've had to sort of redo my chart based upon this analysis of Graham-Cassidy's resulting in 32 million people losing insurance. So that is the equivalent population, 32 million people. It's hard to understand how many people 32 million people are losing insurance over the course of 10 years. That's the total population of Alaska, Delaware, Hawaii, Idaho, Kansas, Maine, Montana, Nebraska, Nevada, New Hampshire, New Mexico, North Dakota, South Dakota, West Virginia. We had to cross out Rhode Island, but then we had to add Mississippi, Arkansas, Vermont, Wyoming, and Utah. And forgive me, I had to do my own artist rendering of these states because the data's coming in so fast and the vote's coming so quickly that I didn't have time to have this chart made up again, but that's 32 million people. Think about that. Think about over 10 years, the equivalent population of all of these states, what is that, 17 states, 19 states, all losing health care at the same time, that is a humanitarian catastrophe. And nobody knows it because this bill is being pushed through without any debate, without any CBO score. But that's what could happen if this passes. And so it's no surprise that basically everybody in the American healthcare system opposes this piece of legislation. The proponents cannot find a single verifier inside the medical community for this piece of legislation. And I heard Senator Graham this morning say, well, that's to be expected. You know, we're making a big reform, and anytime you're making a big reform, the status quo players aren't going to like what the result is. Well, that's a little unfair, because the status quo for groups like the American Heart Association or the Juvenile Diabetes Research Foundation or the American Cancer Association, the status quo for them is that their members, people who have cancer or juvenile diabetes or heart disease, don't go bankrupt any longer because they can't afford insurance. And so, yes, they are kind of upset that 32 million people are going to lose insurance, many of their members, and we're going to go back to the day in which if you were sick, if you had cancer, in most states, you could be charged more. So, yes, people are protective of the status quo. The part of the status quo that makes sure that sick people or people that have been sick haven't lost insurance. So I think it's actually worthwhile, for just a second, bear with me, to just give a quick sense as to how many people in the medical community oppose this bill. Here's just a beginning list. AARP, the School Superintendents Association, America's Healthcare Plans, the ALS Association, America's Essential Hospitals, America's Pediatric Dentists, American Academy of Pediatrics, the American Academy of Family Physicians, the American Association on Health and Disability, the American Cancer Society, the American Dental Association, the American College of Physicians, the American Congress of Obstetricians and Gynecologists, the American Diabetes Association, the American Federation of Teachers, the American Heart Association, the American Hospital Association, the American Lung Association, the American Osteopathic Association, the American Medical Association, the American Public Health Association, the American Psychiatric Association, the American Psychological Association, the Arthritis Foundation, the Big Cities Health Coalition, Blue Cross Blue Shield, Children's Hospital Association, the Center for Medicare Advocacy, the Cystic Fibrosis Foundation, the Endocrine Society, Family Voices, the Federation of American Hospitals, the HIV Medicine Association, the Human Rights Campaign, the Juvenile Diabetes Research Foundation, the Leukemia and Lymphoma Society, the Lutheran Services in America, Main Street Alliance, the March of Dimes, the Medicare Rights Center, the National Association of County and City Health Officials, the National Association of School Nurses, the National Alliance of State and Territorial AIDS Directors, the National Coalition for Cancer Survivorship, the National Health Council, the National Multiple Sclerosis Society, the National Organization for Rare Diseases, the National Partnership for Women and Families, Planned Parenthood, the ARC of Connecticut, the ARC of the United States, the Trust for America's Health, and 47 religious organizations representing various denominations, including Muslim Health Professionals, Alliance of Baptists, Methodist Federation for Social Action, the National Council of Jewish Women, Presbyterian Church of the United States, the United Church of Christ, and the United Methodist Church. That's sort of the tip of the iceberg. You're not really in good company if you are supportive of this bill when every single medical association, every single patient advocacy organization, every single hospital association, every single insurer thinks that you are wrong. You would like to think there might be a couple of these groups which would think it was a good thing to pass a bill that uninsures potentially 32 million, maybe 25 million, maybe 22 million, and jeopardizes pre-existing protections for millions of Americans. And what is so bonkers about this is that we were this close to getting a bipartisan agreement. It's not as if there wasn't another path. I sit on the Health Committee. I had a half dozen conversations with Senator Alexander and Senator Murray. I know that we were 80% of the way there on passing a bipartisan package of reforms, at least out of the Help Committee, that would have kept what was working in the Affordable Care Act and tried to fix what wasn't working. And so I saw Leader McConnell's tweet from earlier today, in which he said, Senate Democrats have two thoughts on how to fix Obamacare. One, do nothing. Two, a fully government-run system that would take away even more of their decisions. That's not true. That's not true, and everybody here knows that's not true. Why? Because Senate Democrats were sitting down and talking with Senate Republicans. We were at the table just a week ago trying to come up with a package of reforms. So to say that Democrats only want a single-payer healthcare system or what we have today is not true. And everybody knows that's not true. I'm certainly raw at the fact that Republicans walked away from that negotiating table when we were so close. I don't think that was in the best traditions of the United States Senate, but I'm ready to sit back down to the table. I know Patty Murray is ready to sit back down at that table if this process blows up, as every previous attempt at repealing the Affordable Care Act with a thoughtless alternative has blown up. My constituents aren't happy with the American healthcare system. They like a lot of the things that the Affordable Health Care Act did, but they acknowledge that there are still lots of problems that need to be solved. And amongst those constituents in my state who like what the Affordable Care Act did but still want to see changes is Isabel and Rylan. Isabel first wrote my office 2 days after the last election about her son, who, this is Rylan, he was born with a congenital heart defect. He looked healthy when he was born. He and Isabel had been scheduled for discharge from the hospital, and Rylan went in for some routine testing, and he never came back. His parents kind of knew something was up, but when the doctors arrived back in their room, they told Isabel and her husband that Rylan needed to be rushed to the hospital for emergency surgery because his body was not getting enough oxygen and there was something wrong with his heart. He was diagnosed with several severe heart defects. He required emergency open heart surgery. And the first thing that Isabel thought was, how are we going to pay for this? Does insurance cover it? And she found out, much to her relief, that insurance did cover it because insurance was required to cover things like hospitalizations under the Affordable Care Act, and that they wouldn't lose coverage because no matter how big the bills got, the Affordable Care Act prohibited insurance companies from cutting you off. And Isabel has been a warrior to preserve those protections in the Affordable Care Act. And I just want to leave you with an email that she sent me this week. She said that she's exhausted, that she is so tired of having to fight over and over and over again for Ireland. She says that she feels like no matter what she tries to do, this repeal is going to happen, regardless of Rylan's story, that they're just going to be casualties to this political imperative to repeal the Affordable Care Act. In 3 weeks, Rylan's going to be going up to Boston for his big cardiac and neuro checkup. She wishes that their biggest fight was to keep him healthy and alive, but it isn't. They are engaged in a political fight to try to stop the protections that keep him alive and keep this family solvent from being stolen from them. This is not a game to Isabel and to Rylan. This isn't about politics. This is about this little boy's life. And I'm going to tell you, my state cannot hold this together. If you cut federal funding for health care by 50% to Connecticut, as this bill would do, maybe more, because what we're hearing is that money is going to be stolen from states that implemented the Affordable Care Act to be delivered to states of members who haven't yet committed to the bill on the Republican side. We can't hold it together for Rylan in Connecticut. If you take away half of our federal health care funding, if you take away the tax credits that help people buy insurance, if you take away the Medicaid that helps insure these kids, if you let insurers go back to the days in which they discriminated against these kids, it's not a game to Isabel. She says, quote, "Every time the repeal comes up," what is this, the third time or more, "I feel sick with anxiety. How quickly the rug will be pulled from under us. How quickly the bricks will begin to fall." We are ready to work with you. We are ready to sit down once again and try to work something out that gets Democrats and Republicans together on this, that does what the American people want us to do. Keep what works in the Affordable Care Act, improve what doesn't work. Please give this up. You are ruining the lives of these families who, in addition to having to save their children's lives, are having to become full-time political activists to stop this from happening. We can do this together. We can deliver peace of mind to these families. It is not too late. I yield the floor.